Building a culture of a healthier Southwest by bridging rural communities that involve families and population health that fosters healthy lifestyles across the lifespan. It must be strongly rooted in social values that address the ways families and communities think, act, and organize their daily routines. Healthcare costs wear many faces and influence the health outcomes of individuals, families, and populations as they develop, live, and work within their communities. Continuing to rely on large acute care settings for healthcare provision is unsustainable as a basis for advancing healthcare to improve health outcomes at a population level, especially for the most marginalized. Our health is greatly influenced by complex factors, such as where we live and the strength of our families and communities. But despite knowing this, positive change is not occurring at a promising pace. Nurses have the opportunity to have a major impact on community and population health by breaking down barriers to ensure nursing education and practice are aligned with societal needs to building a community culture of health. Florence Nightingale had an uncommon vision for a healthier world by focusing her nursing efforts to reduce and protect against threats to the public health welfare of those underserved within communities. Lillian Wald was another respected nursing leader and believed that community health affected individual and family wellness. In the last 100 years, more has been learned about health and illness than in thousands of prior years. Knowledge has advanced more quickly in the last decade than any other historical period. Nursing education, aligned with a culture of community rural health, calls for a well-defined and disruptive change that must involve family and societal needs. Supports for members aging in communities. Collaboration among community agencies to better address social determinants of health. Greater efforts links with family community wellness, health, and prevention needs of disparate populations. Advocacy for underserved or marginalized persons' family units. Communities empowered to support family well-being and healthier lifestyles. There is cause for hope to empower future nurses' roles and education to reimagine community healthcare delivery and make a potent case for community population health to be at the heart of nursing curricula and transfer to practice, sparking epidemiological imagination and challenging nurses to carefully consider their responsibilities to the wider communities, families, and societies that they serve by partnering with service agencies that support vulnerable and marginalized populations and families and provide a range of health and health-related services. Imagination and creativity, innovative solutions that trigger creative thinking and spark innovative solutions that enable nurses to make meaningful contributions to shaping community health and challenging social injustice. Creating more equitable communities and focusing on social issues central to family and population health must be an explicit component of learning that is needed to stir the latent passion of future nurses. In building and sustaining a culture of rural community health, some traditions must be relinquished, and new forward-thinking perspectives about nurses' roles in population health must be taken in making health a shared value. Strengthening the integration of rural health services for individuals and the family as a unit requires a conscious, disruptive change to prepare nurses to deliver a continuum of safe, quality community health care to families and populations in the right forms, to the right persons, at the right times, and in the right places.